Chapter 2, Crises Happen, Helping Families Prepare and Cope. Crises are an inevitable part of the job of a case manager. Individuals and families experience a crisis when they encounter stress beyond their coping abilities, which begins to affect their safety. Stressful situations are unavoidable, and the inability to manage them can lead to crises. While crises can be caused by many factors, they are almost always marked by a substantial increase in symptoms of an individual's behavioral disorder, as stress often exacerbates symptoms. For example, an individual with severe depression may respond to a conflict with a parent or sibling by seriously considering or even acting upon thoughts of suicide. Similarly, an adolescent with schizophrenia may experience an increase in auditory hallucinations when facing changes in their living arrangements. In both cases, stress has triggered an escalation in symptoms, leading to a crisis. When an individual is in crisis, the case manager must act quickly, intelligently, and compassionately to minimize its impact, prevent escalation, and help resolve the crisis while ensuring the person's safety. This section provides an overview of essential crisis management strategies so that you are prepared to act effectively and ensure the well-being of everyone involved. Preventing crises. The best way to manage crises is to prevent them whenever possible. Proactively working with individuals and their families can help mitigate potential stressors before they escalate into crises. Identify stressors. Engage in conversations with the individual and their family members to understand what types of stress are most difficult for them to manage and what has triggered past crises. Recognizing these patterns can help you anticipate and address future stressors. Develop coping strategies. Work collaboratively with the individual's therapist to create effective coping mechanisms. By being familiar with these strategies, you can help implement and reinforce them when the individual is not in a therapy session. Encourage family members and caregivers to support these strategies when you are not immediately available. Address basic needs. Psychological stress often increases when a person's basic needs are unmet. Financial strain, food insecurity, and unstable housing can contribute to stress, which may be internalized by children and adolescents. Utilize available resources to provide immediate assistance and prevent stress from escalating into a crisis. Modify stressful environments. Living in a chaotic, critical, or negative environment can take an emotional toll. While some environmental factors may be beyond the case manager's control, you can help lessen their impact. For example, if a child feels unsafe in their neighborhood, finding an after-school program may provide a secure space. If family communication is negative, suggesting family therapy can create a healthier dynamic. Developing a crisis plan. Despite best efforts at prevention, some crises cannot be avoided. Having a crisis plan in place ensures that the individual maintains their dignity and receives appropriate care during vulnerable moments. A crisis plan should outline how the individual and family prefer to be treated during a crisis. It may include preferred treatment methods, e.g., medication, increased supervision. Preferred treatment locations, e.g., a specific hospital or agency. Steps to follow if the crisis plan cannot be executed exactly as written, e.g., alternative hospitals if the first choice is full. Your agency will have a formal crisis plan form, which should be developed in collaboration with the individual and their family. While plans should be followed as closely as possible, flexibility is necessary in unexpected situations. Assessing the risk of suicide. One of the most serious crises case managers must be prepared for is an individual experiencing suicidal thoughts. When a person feels overwhelmed by sadness and believes there is no way to solve their problems, they may consider ending their life. Adolescents, in particular, may act impulsively without fully understanding the long-term consequences of their actions. To assess suicide risk, use the SLAP method. Specificity. Does the individual have a clear plan? Have they identified a time, method, or location? Lethality. How deadly is the method they intend to use? E.g., firearms versus superficial self-harm. Access. Do they have access to their chosen method? E.g., a gun in the home. Proximity: is there someone nearby who could intervene? Always take suicidal statements seriously, even if the individual has made similar statements in the past. Inform your supervisor and mentor immediately, and ensure the individual receives the appropriate intervention. Acting on crises. Handling a crisis is inherently stressful, but being prepared with the individual's crisis plan and an understanding of available resources will help you respond effectively. There are 3 primary response options during a crisis. Hospitalization: for severe crises where the individual is an immediate danger to themselves or others. If hospitalization is necessary, notify your supervisor, mentor, and the individual's psychiatrist if possible. Call the preferred hospital in the crisis plan to check availability. Arrange for transport by family or ambulance if needed. Stay with the individual and family until they are safely admitted. Maintain regular contact with hospital staff to coordinate discharge planning. Respite care/diversion programs: if the crisis is not immediately life-threatening but requires supervision, a diversion and stabilization (DAS) unit may be appropriate. Steps include: contacting the individual's psychiatrist for approval, calling the DAS unit to check for an available bed, coordinating communication between the psychiatrist and DAS unit, staying in regular contact with the DAS team to plan for discharge. Close monitoring: if there is no immediate threat, increased supervision and support may be sufficient to stabilize the situation. This may involve frequent check-ins, connecting the individual with additional resources, and reinforcing coping strategies. Conclusion: crises are an unavoidable part of case management, but preparation and knowledge can help mitigate their impact. By proactively identifying stressors, developing coping strategies, and establishing a crisis plan, you can help individuals and families navigate difficult situations with dignity and safety. Whether responding to a crisis through hospitalization, respite care, or close monitoring, always seek support from your supervisor and mentor to ensure the best possible outcome for those you serve.